Hi there, my name is Vic Veer. I'm an ENT surgeon working for the NHS in central London, and I want to give you some information about using eardrops correctly. Now, the first bit of this video will be telling you the exact technique about how to use eardrops correctly, and then I'm going to talk about all the things you should be looking out for, all the things you should be careful of, because eardrops can cause permanent hearing loss and other things, so you need to be careful of certain things, and I'll give you a few steps on that as well. Now, personally, I think using eardrops is a two-man job, but if you're by yourself at home trying to put these eardrops in, I'll tell you what I think is the best way to put eardrops in. The first step is to lie on your side as much as possible with the ear pointing directly up to the ceiling, and that way you can make sure that it goes down into your ear hole. Often this means sleeping on a sofa or lying down on a sofa watching TV or something, but just lie down with the ear pointing directly up. Now, the next thing you need to know is that you need to straighten up the ear canal, because normally it sort of slightly curls round as it goes into your skull. So what you need to do, sort of pull your ear up in a sort of Vulcan shape like this. And the reason why you're doing this is it straightens the ear canal. I'll try and show you a video of that as well. But that way you can get the drops to go right down to the bottom, which is normally where these infections start from. In very young children, you need to pull down and back this way, but most people need to pull up that way. Now we're on to step 3. What I'd like you to do is, when you're using the drops, press it against this tragus thing, this bit of cartilage just here in front of your ear hole here. If you press it across there, it seems to seep down past into your ear that way. If you try and put it elsewhere, it ends up in this sort of conchal bowl area over here, and that doesn't really go in. So now we're on to step 4, and you've already been lying down on the sofa with your ear pointing up. You've been pulling your ear up like this. With the other hand, you've got your dropper. It's really quite hard. This is why it's a two-man job. So you're pulling your ear up like this, putting the drops in, pressing against the tragus. You've dropped them through, and now what you need to do is rub backwards and forwards with that tragus. So you're doing this sort of thing, or you're pulling your ear like this. Now, the idea behind this is to try and get those drops down to the bottom of your ear canal, so to get to that area where the infection normally starts near the eardrum. Now, it can be quite painful if you've got an infection of your ear canal, because pulling your ear or pressing that area there can hurt. But please persevere. The more you get those drops down there, the better it will be for you. Now on to step 5. All you need to do is understand that we want the drops to stay in there for as long as possible, so it's effective and it actually treats the infection that you've got there. Because if you just spray or drop them in and then stand up again, it'll all just come out of your ear and it'll be almost a bit of wasted effort. What you're trying to do is lie there for as long as you possibly can, at least 30 minutes. So you're lying on the sofa, watching TV or binging on old reruns of Friends or Suits or whatever you are into, and you're sitting there allowing this antibiotic drop to do its thing in your ear. Now, I appreciate this isn't always possible, so I think really make an effort at the first drop in the day and the last drop of the day. So if you could wake yourself up half an hour early, put the drops into your ear when you're lying in bed, and then maybe snooze for another 30 minutes and then get up and do your normal routine in the morning. And when you go to bed, put the drops into your ears and fall asleep reading a book or whatever you normally do, because it stays in your ear as long as possible. I appreciate having an hour or half an hour's rest in the middle of the day is going to be difficult at work if you're doing this on the desk or something. So it may not be possible, but at least you can do the morning and the evening as correctly as you possibly can, because that will really help you recover quickly from this ear infection, or the reason why you took the drops in the first place. Now, what I'm going to do now is talk about the 5 different things you should know about eardrops before you start taking them. The first is that eardrops need to be made out of 3 ingredients, particularly if you're talking about an infection of your ear canal. One is an antibiotic, one is a steroid drop, and one is an acid. And all 3 are really useful when you're trying to treat infections of the ear canal. When you have an ear infection, the wax that's created in your ear is no longer being created. Wax is there to acidify the ear, make it acid, so it kills off some of the bugs. Because the lining of your ear has been infected, wax isn't being created, so you need to replace that acid that the wax used to be there for with an acid in your drop. So that's why most good drops will have acid in it. Next thing is the steroid I mentioned. Steroids reduce the inflammation in your ear, open it up so the drops can actually get down there. Also gets rid of that itchiness and the feeling of swelling and pain, because sometimes it gets so swollen that the sides of the wall press together, and that's acutely painful, really painful, that sort of pain when the sides of the walls touch each other like this. And the steroid reduces that as well. The antibiotic is really useful as well. Now, there are lots of different antibiotics, all of the same class, Amnioglycosides. So there's Sofradex, Otamize, gentamicin. All of these drugs have different ingredients in them. So, for example, Sofradex, which is an antibiotic, the Sofra bit of that name, and Dex, which is a steroid, it doesn't have an acid in it. So you do need to give Sofradex, and then on top of that, use something like ear calm spray, which is an acid at the right sort of pH level that replaces the wax acidity that you've lost. So you need to give Sofradex with ear calm. There's also gentamicin, which is another aminoglycoside antibiotic, but it doesn't have any acid or steroid in it, unless it's gentamicin HC, which is HC stands for hydrocortisone, which is the steroid. So you need to give the gentamicin along with betnazole, which is an sort of a steroid for your ear, and then along with the ear calm acid spray as well. So you need to give all three at different times. It's rather difficult to do that because you're tripling the number of times you have to lie down on the sofa and put the stuff in your ear. Now, personally, I like Otomize spray because it's a spray, so it's better. It's much easier to use a spray than ear drops, and it has an acid, it has a steroid, and it has an aminoglycoside antibiotic all in one. So that's why I like it the most. But whatever your doctor gives you, just make sure you manage to get all three ingredients. Now, the second thing you need to remember with these antibiotic drops, you have to be careful that you do not use aminoglycoside antibiotics for too long, because if you do, aminoglycosides actually cause hearing loss, permanent hearing loss, and also cause vestibular problems or balance problems as well. They're toxic to your ears and toxic to your balance. Now, actually, they're not that toxic. You can use them for a short time, and most times we only give these antibiotic drops for less than 2 weeks. We say in England, there's a review done in 2007, I think it was, where ENT UK came out with a bunch of doctors that said, look, actually, a lot of these risks are slightly overstated. You can use these drops for less than 2 weeks with no real harm to yourself. But what tends to happen, particularly with the modern NHS, where you end up seeing different doctors all the time, and people can get confused about what your treatment has been up till then. People might give you Sofradex one day and go, oh, it didn't work. All right, we'll try gentamicin. Oh, that didn't work. Try Otomize. And what happens is that people are doing the same drug, a same aminoglycoside class of drug 3 times, and you end up having 6 weeks of aminoglycosides, which can cause hearing loss. So just be really, really careful that if you have one short dose, I normally say 10 days is safe. So one short 10-day course of aminoglycoside antibiotics, and then you can't have any more, because if you keep having them, you'll cause hearing loss and balance problems as well. So just be very careful with that. As I said, the ENT UK guidelines said that we can use these for less than 2 weeks. It's really safe as far as England is concerned. I think other countries worry about this a little bit more. I think the Canadians, the Americans, maybe the Australians worry about this a little bit more than us. But the evidence isn't there for worrying about it for less than 2 weeks. If you have been in the situation where you've tried one antibiotic and it hasn't worked after 10 days, you need to be reassessed and look in your ear. And if it seems that you still have an infection, particularly if the swab that's taken shows that it's resistant to aminoglycoside antibiotics, then normally we move on to a ciprofloxacin antibiotic, which doesn't cause the amount of hearing loss and problems that the aminoglycoside class of drugs does. Now, although we say that 2 weeks is safe, there are people who are a little bit more sensitive to these drugs. So, for example, very, very young children, and they don't really state how young. I think they're talking about less than 2 years old. But I worry with anyone under sort of 7 years old. So just be careful with children who are being given aminoglycosides. It might be worth swapping directly over to ciprofloxacin for those people. And there are people also who have mitochondrial DNA problems as well. So if you have a mutation of the small subunit ribosomal RNA, or I think it's called 12S rRNA, then those people seem to be more sensitive to aminoglycosides. So you need to be a little bit careful if you're using these antibiotics, because it can cause permanent hearing loss in those people. Now, what I normally do in some cases where you've given 10 days of antibiotics and the infection's mostly gone, but there's a little bit left over and you think, maybe I'm worried it's going to come back again if I don't treat it with something. I normally give ear calm and just tell them to keep using ear calm until everything's settled down, because the acid in ear calm will get rid of any mild infections. You can buy this over the counter in England. I'm not sure about other countries. So that's the way to just finish off an infection, which was really bad initially, but you don't want it to come back again and be resistant to everything that you can give to them. That's why we worry about using ciprofloxacin from the start, because then you've got nothing else you can give people. Now, number 3 of the things that you should remember, you need to make sure that you're taking ear drops for the right reason. Now, if you have an ear infection, you typically have discharge coming out of your ear, either because you've got an infection of the ear canal and some discharge is coming out because of that, or you have a hole through your eardrum and stuff from the middle ear is pouring through that hole out of your ear canal like this. Ear drops are useful for both of these things. So you have to be a little bit careful that you're making sure that you're using ear drops for the right reason. Now, if you have otitis externa or an infection of the ear canal, it becomes very obvious that you have this because you have tenderness, not really much pain when you get it. So what we mean by this, it's a pedantic sort of thing that we surgeons talk about. But tenderness is when you press the ear or touch the ear or pull the ear like this, it causes acute pain. Whereas if you don't touch it, it doesn't hurt quite as much. So for example, if you had a eardrum that was fully intact and you had a middle ear infection, so it's pushing against the eardrum, that causes pain, not tenderness. So you can go like this and go, oh God, it's really hurting. And your kids are sort of crying at night. You're stressed because you can't do anything for them. That is pain. Whereas tenderness is, you only really get the pain really badly when you touch the ear or pull the ear like that. That's when you know it's more likely to be an external infection, an infection of the ear canal, rather than a middle ear infection without a hole through the eardrum. So if you have discharge, that makes sense. You can take drops for that. And if you have tenderness rather than pain, then using ear drops is useful in that situation as well. Using ear drops when there isn't a hole through the eardrum, it's not any good because all you're doing is pouring these drops in. It's not going to go through an intact eardrum. And so all you're doing is getting all the side effects and the risk of hearing loss with eardrops, when really you need to be treating the middle ear problem rather than putting drops into the external part of your ear with no way of getting through. Number 4, the things you should know, if you have a lot of discharge in your ear, putting drops in is not particularly useful because the drops are sitting on top of the pus inside your ear. It's not actually getting to the skin, the infected area underneath. So really, to do this properly and make sure you sort it out the first time round, because you've only got limited time with these aminoglycoside antibiotics, you need to keep the ear as clean as possible. So when the drops go in, they touch the skin of your ear canal rather than the muck inside there. So you do need to see an ENT surgeon, or personally, I would go and see someone more available, someone like Conor Boland. If you look at the Durham Hearing Specialist YouTube channel, he's brilliant at keeping ears beautifully clean. Watch him as he uses, it's an absolutely amazing technique. He cleans ears beautifully, better than most junior doctors that I know. He can clear ears out without causing damage to the ear canal at all. And that means when you put the drops in, it touches the skin, and people, I'm sure, would get much quicker under his care than just putting drops in with discharge everywhere and it all making muck all over your pillow. So it's really useful to keep your ear as clear as possible. So if you can see someone who can clear out your ear, that's the way to go. Now, the 5th thing I want to talk about is make sure that you're taking the ear drops for the right reason. If you've got an acute infection and you just want to solve it with the antibiotic drops, with the steroid and the acid as well, then that's the right thing to do. But you want to make sure that you're not causing, you're not masking an underlying problem. So, for example, some people take antibiotic drops, get rid of an infection, but what happens is they end up taking too much, or something happens and they have a fungal infection on top. So it's a bit like sometimes when women take a lot of penicillin, they end up with thrush, and they end up having thrush for a long time until they get rid of the thrush with canesten. Now the same thing can happen in your ear. You get rid of all the good bugs, you get rid of the ear gets infected with fungus, and so although the terrible infection you had initially has come back down, you've got this grumbling sort of pain in your ear. It sort of weeps a little bit. It's not as bad as it was before, but this grumbling sort of ear infection. And then because you've got a fungal infection there, you can get we call it a bacterial superinfection. So another infection comes on top, causes infection, and then you spike up again, take some antibiotic drops, and it comes back down. But you've always got this underlying fungal infection, which is causing irritation to your ear and making you prone to get another bacterial infection. So you've got this cycle of peaks of nastiness, and then it settles down a bit. What you need to do is sort out the fungal infection to stop you getting all these bacterial superinfections as well. So again, seeing someone like Conor at Durham Hearing Specialist, please look at his channel. It's great. Subscribe to that place. And the other thing to be wary of is that some people, when they put the drops in, it gets better, but then the discharge comes out again straight away. And occasionally, very occasionally, you can get a thing called a cholesteatoma. Cholesteatoma is a growth of ear cells which are going round and round in circles rather than coming out the normal way. And they're going round and round in circles, causing infections and eroding the bone inside your ear, causing damage and hearing loss and things like that. So if you're constantly going backwards and forwards to your GP saying the infection's come back again, then just be wary that there's something underlying there that you need to get sorted out. Now, if you want to know what a cholesteatoma is in a bit more detail, I've got a video here for that. But I do hope you found this video useful, and I hope to see you in the next one. Do take care. Bye-bye.